Hey Vision Therapy Club. I'm gonna go over all the different things that we just got in our vision therapy kits here, kind of showing you what they're for, how to use them, just so that we can get nice and familiar. Because especially the first and the second years are just kind of getting into this stuff, or for the first years a little bit down the line. And yeah, I just wanted to kind of let you know what you got here and how you're gonna be using it in the future. So let's get into it. So we're going to start by talking about the Brock string here. The Brock string is great. It's a really old therapy, and it's great for all sorts of different types of visual issues, right? So convergence insufficiency, convergence excess, divergence insufficiency, and divergence excess. All can find some good therapeutic benefit out of the Brock string. So I'm going to go ahead and grab my string that I've got set up here. And what you're going to want to do is that you're going to want to tie one end of the Brock string, the end over there, somewhere kind of eye level to the patient. So I have mine tied to a window and I'm able to stand up. But sometimes maybe you need to tie the end to a doorknob and then the patient can stand on their knees and then do the therapy exercise. So your Brock string is a string with 3 beads. I mean, it's pretty simple but pretty effective. So let's talk in the case of convergence insufficiency, for example. Someone who's having trouble bringing those eyes together. So what you can do is that you can take this one bead here. Let's do the green bead. You're going to have them hold the string right here at the tip of their nose, kind of pinching it right at the tip of their nose. And then they're going to bring in that bead. And you want them to try best to keep that bead single. And you're going to move it in until it's double. Let's say it's double right here. And then of course you're going to do your recovery and then back to single there. This is kind of the closest bead, the place that you're going to want to work and have them do a lot of their exercises at. So the nice thing about the Brock string is that you're able to start with some smooth vergence activity. So you can take a bead and you can just move it in and out, having them keep that bead nice and single. And then once they're ready to move on to something a bit more difficult, you can incorporate the other beads and then have them do jump vergences, going from green to yellow to red, and having them keep those beads single, kind of pushing their convergence and having them do these exercises. One of the very nice things about Brock string is that it's able to kind of check for suppression. So when you're doing these exercises, what you should see if you're looking right here at one bead is you should see 2 strings going into it and 2 strings coming out of it in the shape of an X. That's kind of that natural kind of crossed-uncrossed disparity that you get when you're looking at the target. And that's a great way of checking to make sure that the patient is still not suppressing, that they're still binocular, is asking them how many beads are coming, or how many strings are coming into the bead, how many strings are exiting the bead, just so that they're able to monitor both in office and at home for themselves. Oh, I'm suppressing, so I should move the bead a little further out, or maybe sometimes kind of waking up that suppressed eye by either tapping the bead, blinking a few times is a good way of getting them to kind of stop suppressing. All right, so let's talk about something else in the kit here. This right here is the 3-barrel card. This one is pretty much exclusively for convergence insufficiency because it's really demanding on that convergence and making sure that you're able to bring those eyes together. So what you do is that you have them place the card right here, right on the nose in between the eyes. And what it does is it presents a common target, a similar shaped target on both sides of the card, but as different colors. The different colors is what gives it kind of a suppression check in itself. If they're seeing a barrel that is just green or a barrel that is just red without having that kind of luster combining effect of the colors, then you know that they're suppressing. So you're gonna hold this bead or the card right here, and it creates a natural septum, which actually helps a lot of patients with these issues be able to converge together. And what you're gonna do is that you're gonna have them converge the barrels on the end, and then move in, and then in on that card. And that can be pretty difficult. You know, it's a pretty high convergence demand. And if a patient's not getting it, what you can have them do a lot of the time is you can start by having them look at a pencil or something a little bit further away, and then just watch that pencil as it moves in and in and in and in and in, and then you can have it touch that first barrel there, and they should be fused at that point right there to help them kind of get going. So a bit more of a difficult activity, But the most difficult one that you have in your kit here is the Lifesaver card. So the Lifesaver card is supposed to be one of the most difficult activities for someone with binocular vision issues, because there's not a lot of cues really to be able to fuse this on its own. It kind of relies you on it relies on you to have that ability to converge and diverge your eyes at will, which can be difficult for someone with binocular vision issues. So essentially the goal, depending on what you're doing, whether it's convergence insufficiency or something like convergence excess. So convergence insufficiency, you're going to want to work their ability to converge their eyes, while convergence excess, you want to work their ability to diverge their eyes, right? So what you're going to have them do is that you're going to have them kind of cross their eyes to fuse these two lifesavers together. And that sounds pretty tough to do, and it definitely is. So one eye, in my case, I guess it's hard to, to kind of demonstrate it like that, but my right eye is going to be looking at this circle, and my left eye is going to be looking at this circle. So when they're both in your central vision, they're going to fuse together despite them being two different targets. And then moving up the card, they get more separated, and that's going to be a higher demand regardless if you're doing divergence training or convergence training. Just bigger separation of the targets is bigger demand. So yeah, this one can be a little tough to do, and something that can help is by looking at a target in between your eyes and the card. So to get that kind of 3D effect, you need to find that point where it combines the two lifesavers together and you get that luster. One nice thing about these cards is that it has focus written on it, which is great because that's a good control for accommodation, making sure that they're not just seeing blurry circles, but are rather coordinating their binocular vision system. And then also, because of the separation of the letters is different on the two cards, you can see the green one, it's a little further apart. It creates a 3D effect to the words, and that some letters will stick out, some of them will go deeper in, and you can ask your patient about that to make sure that they're properly converging the two lifesavers. All right, well that is all I have for you guys today. I hope that you have some fun playing around with the stuff in your vision therapy kit, and that it becomes useful for you when you start to see patients in clinic, if you haven't already. All right, see you guys.